Hello, my name is Rachel. I'm a mother and early childhood educator. I would like to share with you a little bit of what I know about wireless radiation and sensory processing disorder, or SPD. Wireless radiation is emitted from devices such as cell phones, cordless phones, laptops, baby monitors, Wi-Fi routers, smart meters, cell phone towers, and more. The amount of man-made radiation, wireless radiation, in our environment today is staggering. We see children of all ages placing wireless devices up against their heads and bodies without giving any thought to the potential harm this may cause them. In the article entitled Protect Children from EMF, 2015, scientists Markov and Gregoriev state, for the first time during the whole history of civilization, the most critical system of the body, the brain and nervous structures of the inner ear of the child and adolescent, are exposed to unknown risk of RF EMF. Exposing the brain and the nerve structures of the inner ear, such as the receptors and transmission pathways responsible for normal functioning of hearing and the vestibular analyzers, children undergo serious risk. Sensory processing disorder is a neurological condition affecting many children. Conservative estimates indicate 1 in 20 children suffer from SPD, while another study indicates 1 in 6 are affected. SPD can be a debilitating condition affecting a child's safety, self-esteem, relationships, daily routines and activities, and their overall quality of life. Most people are familiar with the 5 main senses: touch, taste, smell, hearing, and sight. There are 2 other major senses, the vestibular and proprioceptive senses. The vestibular sense is the first to develop at 12 to 14 weeks of gestation and is the foundation for all other sensory systems of the body. The vestibular sense, located in the inner ear, is responsible for our sense of balance and movement. It helps us to maintain an upright position, provides information on spatial orientation, and tells us how fast our body is moving. The proprioceptive sense, also known as the position sense, includes receptors located in the skin, muscles, and joints. Our proprioceptive sense provides information about the position of our body parts without looking at them and helps gauge how much force, pressure, effort to use when completing a physical task. All of our senses are closely linked and work in concert with the brain to achieve normal sensory integration. When a child suffers from SPD, their brain is either not receiving sensory input or not processing sensory input accurately. As a result, the child may be under or over responsive to certain types of sensory information. When a child with SPD is overly responsive to a type of sensation, they will show signs of sensory defensiveness or avoidance. When a child is under-responsive to a type of sensation, they will exhibit sensory-seeking behaviors. Individuals can have 1 or more impaired senses, and they can exhibit both under and over responsive behaviors at different times. Many children with SPD are misunderstood because of a lack of common knowledge about this condition. They are often misdiagnosed or simply not diagnosed at all. There is a debate regarding whether SPD is actually a separate disorder or a characteristic of other disorders such as autism, attention deficit hyperactivity disorder, anxiety disorder, or Fragile X syndrome. Exposing children to microwave radiation puts them at risk for developing sensory processing disorder. Here is some evidence to consider. Number 1, exposure to wireless radiation is the primary cause of autism, according to leading experts. The overwhelming majority of children with autism have sensory processing disorder. In fact, it is one of the main indicators doctors use to diagnose autism. 2, sensory upregulation is very common in people who suffer from electrohypersensitivity. This includes hypersensitivity to light, sounds, smells, tastes, skin sensitivity, and multiple chemical sensitivity. 3, scientific evidence clearly indicates that the inner ear, the vestibular apparatus, is highly vulnerable to the impacts of exposure to wireless radiation. For the developing child, it would stand to reason the impacts of exposure could be very damaging to their sensory systems. Preventing sensory processing disorder is yet another very important reason to protect children from wireless radiation. Please take the time to learn more about this topic by visiting the National Association for Children in Safe Technology website, nacst.org. Thank you.